During perio probing, the first thing you want to do is make sure that your perio probe is lined up parallel with the long axis of the tooth. We're going to start at the distal line angle of each tooth, placing our perio probe tip into the sulcus. Using gentle walking, bobbing strokes, we will walk from the distal line angle all the way around into the pocket, into the contact where our probe can no longer go any further. This is called the 2-point contact. At that position, we will slightly angle our perio probe into the sulcus or pocket, making sure that the tip of our probe is angled toward the coal. Once we get our measurement, we will then walk around the tooth, coming back around through the distal and onto the facial, where we find our deepest reading and move along into the mesial surface. Once again, getting to that 2-point contact where we can go no further, stop, and angling and measuring into the coal. When we're probing anterior mandibular teeth, we're going to be sitting at the 8 o'clock position for right-handed, 4 o'clock position for left-handed. We're going to start at the distal line angle, and once again, making sure that our probe is parallel with the long axis of the tooth. Kick the point out about 10 degrees so that you enter the sulcus. Move into the interproximal space and angle downward towards the apex into the coal. As we come around the mesial, we're going to do the same motion. The biggest mistake that people make when probing is that they begin to enter the interproximal space with an already angled probe. If this is what you do, you will get an inaccurate measurement, because what you are actually doing is measuring in between the interproximal space. That is not what we want. We want to measure into the sulcus, taking our perio probe towards the root at the coal. One way to think about probing in the anterior teeth, it's almost like your probe is teeter-tottering between mesials and distals. Another way to think about it is that your probe is making a V shape as it angles toward the apex. When perio probing maxillary anterior teeth, the same principles apply. We initially line up our probe with the long axis of the tooth and then kick it out about 5 to 10 degrees so we can slide the point into the sulcus. Once we enter the sulcus, we never come out. We will round from the distal line angle into the 2-point contact and angle the point of our probe into the caul towards the apex of the tooth. We always want to take our deepest measurement. So if you are gliding yourself here along the facial of tooth number 8, the deepest measurement may not be directly in the middle. The deepest measurement on the facial may be on the mesial facial. Once we reach that 2-point contact on the mesial, we angle our probe towards the apex into the coal and take our measurement. Again, if we walk in too angled to begin with, we will get an inaccurate measurement, and we will not be actually measuring the base of the pocket to the gingival margin.